Hello, I am Dr. Punit Khanna. I am Head of Respiratory and Sleep Medicine at Manipal Hospital, Sector 6, Dwarka. Sleep health or sleep hygiene has come into recent focus with the advent of COVID and because of the need for many of the patients and public alike to stay at home and work from home. In the recent years, it has been seen that people are now getting more knowledgeable about their sleep patterns, their sleep hygiene, but still this knowledge is very less. It's not very sufficient, and there is still a severe lack of understanding between the general public at large, and surprisingly in many physicians also about the importance of a good amount of sleep and the various sleep disorders that can happen and lead to an injurious lifestyle. It is a matter of regret that even in undergraduate medical education and sometimes in postgraduate medical education, the sleep study per se or the sleep science is not given that due importance. But now the time has come when we should address this very important aspect of our life, because we need to understand that we spend 1/3 of our lifetime in sleep, and this good quality of sleep eventually leads us to a good healthy life and a long life to live with. Well, impaired sleep quality or a poor sleep quality is now very well established, known to cause severe metabolic disturbances, including hypertension, diabetes, obesity, endocrine disorders, mood behaviors, and neurological disorders, and severe disease like cardiac and neurological strokes. The perception about sleep has always been that it's a lifestyle disorder and almost invariably related to obesity, but that is not true. The data has suggested that it's not a lifestyle disorder. It sometimes becomes a very, very major part of your work space. It becomes part of your routine health. And it's not just the obese people who get sleep disturbances. 30% of patients with severe sleep disorders may not be obese and have lower BMI. So it's very important to understand that this metabolic syndrome, which includes the complications of diabetes, hypertension, or the disease which occur later in their life, they have their genesis in the sleep disturbances that many of these patients face day in and day out. Unfortunately, the insurance companies still classify obstructive sleep apnea or sleep disorders as part of lifestyle disorders, and their diagnosis and treatment is not covered in many of the insurance policies. Well, that is a fallacy, because it has been shown now in many studies over the last decade that sleep disturbances can lead to severe cardiovascular morbidity, metabolic morbidity, obesity, diabetes, and associated complications. So if the insurance company promotes or supports the diagnosis and investigation and management of sleep disorders, then they can go a long way in promoting health to many of these patients, and they may not suffer the consequence of a cardiovascular morbidity or a diabetic morbidity later in their life, thereby saving a huge amount of money that every individual spends on their health in subsequent years. The government of India has now given a huge push to infrastructure in terms of making new highways, increasing the mobility of population across the states, across the length and breadth of our country. But we have conveniently ignored that the people who are going to drive on these roads are going to be truck drivers, bus drivers, cargo transporters, people who travel long distances, and we have not given due attention to the health of these individuals. We have not given attention to the infrastructure that will be required to maintain their optimal sleep quality and their health status. It has been shown in large number of studies that a large number of road accidents are caused by human error, which invariably results from lack of sleep in the drivers. And because of this reason, it is very important that a regulation must be in place where the drivers of long distance carriers or people who are going to travel for long distances on these highways, they should be mandatorily screened for any sleep disorder, and their licensing of driving should mandatorily be linked to their optimal sleep health or sleep hygiene. Almost all Western countries, including US, UK, and Australia, the drivers of long vehicles or vehicles which carry transportation across the country on large wheels, they are mandatorily required to undergo a sleep test and a sleep certification. In fact, in UK, a sleep disorder is characterized as an adult disability and is one of the reasons for denying a license. it is very important for our country also to incorporate legislations where prior to motor licensing, motor vehicle operations, it should be mandatory for the driver to obtain certification that he or she doesn't suffer from sleep disorders or sleep disability before he is given the license to drive on a highway. Another important subset of people that we encounter who have tremendous sleep disturbances and that results in their poor health are people who work in shifts. So nowadays in our country, a large number of young population is working in shifts, particularly in BPO and service industries, or for that matter, workers who work in shift industries, who have got very poor sleep patterns and sleep hygiene. Now these people, although they are young, if they do not get adequate sleep and go on to develop sleep disorders, this impaired sleep can lead to a huge epidemic of health issues and metabolic problems around 10 years from now. So it's also very important that as we promote more and more young workforce in our night shifts, we should take adequate care about their sleep patterns, adequate sleep that they get, and the sleep shifts should be restricted in a manner that no patient suffers from sleep deprivation, because sleep deprivation is going to harm their health 10 years from now or 15 years from now, and we are going to face a huge epidemic of these people after some years.